Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter R. Today I'm going to talk about the renal insufficiency and the renal failure because it's not uncommon and also the impact of renal insufficiency or renal kidney failure is beyond just the kidneys themselves. It's because the close connections with the other organs like the liver, the brain and the heart. So let me just bring up the emergency situation associated with this renal insufficiency or renal failure. Usually this not occurred in healthy people unless you have cyst in the kidney, bilateral, and you do not know and suddenly developed. Actually, it's not quite common. So the emergency situation usually occurred with those chronic renal insufficiency or renal failure flaring up, the symptoms getting worse, the kidneys function deteriorate. So that means the edema, fluid backup the whole body and can overload the fluid, can really cause the heart problem, and also the toxins can really accumulate to the brain, nervous, like toxic to the nerve cells, alter the mental status, and also increase the burden of the liver, cause the liver failure. So this is about the eventual or the worst scenario of the uncorrected renal failure. The emergency situation usually associated with the electrolyte imbalance cause the heart arrhythmia. That's quite dangerous, and also alter the mental status because of the toxic to the nerve cells. So that is also quite emergency. So this is about the emergency situation. What are the signs? Alter the mental status, getting stupor, and really these are for those who had chronic kidney diseases, and also the heartbeat is irregular or slow or too fast. So these are all the signs associated with this kidney insufficiency and failure. So this is a kidney insufficiency or failure. You cannot manage it home. It has to be managed by the physician, closely monitored, because it is like I mentioned, the impact is so broad in other organs. Other organs also be affected. So let me just, usually the insufficiency could be acute or chronic. The acute kidney insufficiency usually I think is caused by the obstruction, bilateral, has to be bilateral. So it's, and also acute glomerulus damage cause the loss, huge amount of blood and huge amount of glomerulus loss function. It's not like a focal segmental but diffused. So usually probably this is about the acute phase, but a lot of time it just this becomes chronic renal insufficiency. The chronic renal insufficiency, however, is quite common because of the systemic disease, the diabetes, of course, the notorious diabetic renal failure. That's very common cause, and also irreversible because of the small blood vessels in the kidney damaged, either aneurysm or ischemic, and then bleeding. So that's one of the most common cause. The same as hypertension cause the chronic renal failure, renal insufficiency. The same idea. The blood pressure is high and ischemic damage to the kidney. And I think when I talk about the kidney disease, I mentioned about the endocrine function of the kidney, secrete the renin, and also the part of the angiotensin function at the kidney. So really constrict the blood vessels, make the ischemic worse through these mechanisms. But anyway, so these are the quite common chronic renal insufficiency. In terms of the other causes of interstitial kidney diseases. Those interstitial kidney diseases usually caused by the toxins or by the medications, like some chemo drugs or some a lot of medications can have, because the medication has sometimes either excreted by the kidney or by the liver through the digestive system. So a lot of medications really have a toxic effect to the kidney. So these are the causes of chronic kidney insufficiency. Of course, on top of that, there's some bilateral obstructions. That's not quite common. And if it occurred, usually it's bilateral acute kidney insufficiency, because the obstruction usually is not, unless structurally not normal for the newborn. Usually, if the kidney stone dislodge the block on one side, just cause the pain, not enough to cause the bilateral renal insufficiency, and also probably the unilateral renal insufficiency, but the other kidney still function to replace. So this is about the mechanism, the causes of the chronic renal insufficiency. It's just notoriously hypertension, diabetes, and medications. That's probably the top of three. There's some other causes, autoimmune causes, for example. But for those, unless it's diffused nephropathy, if the local or focal segmental treated on time and treated the causative factors that could be reversible. However, if, for example, lupus caused or other autoimmune disease caused, even though at the beginning it's focal segmental, but still can really going down to the diffused clinically like the renal insufficiency. So these are the causes. In terms of the symptoms, of course, edema, that's the one of the most important symptoms, presentations. The water accumulates. On top of that, if the electrolyte imbalance or if the hormone imbalance, anemia, for example, because kidney secrete the erythropoietin, which is stimulating red blood cells generation. So if the kidney insufficiency, those hormones decreased, and also the electrolyte imbalance cause the hyperkalemia, that's dangerous to the heart, or hypokalemia, and also the sodium abnormality cause the fatigue and also cause the heart problem. So this is probably the very superficial. This because the kidney insufficiency, kidney failure is one of the most complicated clinical encounters, because the patient can present in variety of symptoms, variety of causes, and in terms of the clinical scenario, could be minor, could be severe, could be life-threatening. So this is because so many mechanisms or so many routes to be involved and to regulate it under this kidney insufficiency or failure. So, but this video here just touch the basis and also very superficial, just give you some idea what are the common causes. And for those who have chronic diseases like hypertension, diabetes, follow up with your physician regularly to test it, to diagnose at early time, to make sure not progress to the end stage of kidney disease. That's really kind of dangerous and irreversible. The transplant probably is the only solution. So I'm going to stop here, and hope it helps. And for those who do not have the chronic diseases, but just hope that it can trigger your interest to search more about this kidney and its function, and particularly if the kidney loss function, what will happen to the body. So I'm going to stop here today, and thank you for watching. I'll see you next time.